You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. The JAMA Network recently posted a podcast entitled Structural Racism for Doctors. What is it? The Journal of the American Medical Association is a peer-reviewed medical journal published 48 times a year by the American Medical Association, the largest medical group in the country. It publishes original research, reviews, and editorials covering all aspects of biomedicine. They promoted the podcast on Twitter with a tweet that began, go ahead and show it, y'all, "No physician is racist." Show the tweet, please. Okay, I don't know why we don't have the tweet, but the bottom line is, y'all, it just makes no sense whatsoever. They released a statement. I'm going to read that in just a second. I want to go to my panel, Dr. McDougle, President-elect, National Medical Association, Dr. Isha Kooree, and Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Kooree, I got to start with you. First of all, how shockingly and stunningly stupid this was released. I guess these folks also forgot why the National Medical Association was started, because of stuff like this from the American Medical Association.
Yes, so clearly with my situation of suing my institution for race and gender discrimination, definitely flies in the face of that kind of statement. And I posted on Twitter in response that you're clearly not remembering the history of your parent organization. The tweet, the podcast was stunningly traumatizing for me because it just invalidates the experience that I am having and that so many of us have had in medicine.
Dr. Benjamin, when you saw the tweet and you saw them, even the podcast, just stop it. And all these white doctors, thank God y'all said this. There's no racism among physicians. Thank goodness. I'm sorry. We know one of the reasons why black folks were not hooked on opioids early was because white doctors would not prescribe opioids to African Americans. We know what the research says, how black patients are treated by white doctors. This notion that, first of all, we got the video of the black woman who died from COVID when the hospital was refusing a medical care for her. Give me a break.
Oh, listen, racism exists in medicine. We know that it does. Why should physicians be any different than the rest of society? It does exist, both personalized racism and structural racism. And so we have a lot of work to do. And I think the medical profession, we all have to clean up our own house first.
It was just interesting to me, again, Dr. McDougle, because this led to a massive reaction from black doctors. I'm talking about they blew up social media, forced JAMA to take the tweet down, forced them to also issue an apology that, and some say, still is not a sufficient apology. This is the actual tweet, Doc, that they put up. No physician is racist. So how can there be structural racism in healthcare? An explanation of the idea by doctors for doctors in this user-friendly podcast from the great Dr. Katz, NYCHH, and EHL JAMA. How did you feel when you saw this?
Well, Roland, you bring up such wonderful topics to discuss. So this, I would think, goes back to the curriculum of medical school. So in medical school, if you're not taught about racism, institutionalized racism, personally mediated racism, and internalized racism, if you haven't read Dr. Kamara Jones, The Gardener's Tale, a theoretical framework of racism, that needs to be part of the curriculum. So education is the key.
Dr. Kooree, again, what's amazing here, this, as I saw this, and then I saw the reaction of these white doctors, all I could think about was Mike Pence on the debate stage saying, all of this implicit bias stuff, all of this talk about systemic racism, this is not America. This is not who we are. basically what these white doctors are saying is, the hell with all y'all black doctors. We ain't listening to none of y'all.
And I think that's why you saw a collective of us respond. I know that individually, a group of physicians that I've come to know that are advocating through our online advocacy came together, and we wrote an email, a letter to Dr. Katz and others, and soon we will be publishing those responses. But I also have to say, just in my experience, to Dr. McDougall's point, this is about education, not only in the classroom, but beyond. But we do need institutions like the NMA to come out when Dr. Denner and I are being removed from positions when we're trying to do our jobs and educate in medical and training institutions. Additionally, we see that there is an intolerance for this from our white colleagues, especially our younger white colleagues. They were just as
gleeful.
They
were gleeful.
Well, some for sure. But at least the folks in my circle were just as ardent in the removal of such a ludicrous statement.
This was the statement they released. Go ahead and pull it up, y'all. I'm going to read this. I want to read this and I want to get y'all reaction to what JAMA released. This was on March 4th. Come on, pull it up, please. Thank you. On February 24th, JAMA tweeted about a recently posted podcast discussing structural racism in medicine. The language of the tweet, as well as portions of the podcast, do not reflect my commitment as editorial leader of JAMA and JAMA Network to call out and discuss the adverse effects of injustice, inequity, and racism in medicine and society, as JAMA has done for many years. I take responsibility for these lapses and sincerely apologize for both the lapses and the harm caused by both the tweet and some aspects of the podcast. JAMA will schedule a podcast in the future to further discuss issues of structural racism and health and to address concerns raised about the podcast. Howard Balkner, editor-in-chief, JAMA and the JAMA Network. Dr. Benjamin, your response to that?
Yeah, well, I'm glad Howard did that. But I think the fundamental problem here is a lack of understanding from some people what structural racism is. Structural racism is a system of disenfranchisement in our communities. It's when you don't allow people equitably to get on the medical staff. It's where you put your hospitals. It's how do you set up your appointment systems, in addition to how you might treat patients in the healthcare setting. Numerous studies, even published in JAMA, have shown the inequities that the people of color have received in the hands of practitioners who are not treating them equally. And many of these systematic problems have occurred for years. I was in Washington, D.C. when we had a city hospital. And, we had actually a service that was certainly at the city hospital, but on one service, most of the residents were white. And on the other service, most of the residents were African American. And they represented the historical inequities of the system that was still there in Washington, D.C. at that time.
Dr. McDougle, what should happen next?
So what should happen next is, one, Dr. Aletha Maybank at the AMA, she is their chief equity officer, so I'm sure she's involved with this. And so the fact that this went out on their forum, I would think that increasing diversity of their editorial staff and accountability would be one of the things that would happen. And then I'd like to speak to, someone mentioned something about the National Medical Association not being involved. We are engaged in Tulane. We are engaged in Indiana with Dr. Susan Moore, and the president of the Golden State Medical Association of the NMA is engaged in California. So these things are being addressed. And so I just want to speak to that. And so, but back to this issue, I know that the AMA has a number of Black leaders who are stellar in their work. So I think this will also provide a learning opportunity for them to be raised up and to be listened to.
Dr. Kooree, final comment.
Yes, I greatly agree with the demand for the editorial board and of this journal and many others to be diversified. Things like this won't happen when we have a seat at the table.
All right, then, folks, I surely appreciate it. Thank you so very much. And we did reach out to JAMA, and hopefully they'll have the courage to come on to talk about this, because certainly they definitely need to diversify their staff, because that was absolutely crazy. We appreciate it. Thanks a lot. All right, folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have that you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.